Obviously, this statute provides a lot of benefits to people who are employees, and I think what will happen as the courts start interpreting and applying the statute is that they will do what they've done with a lot of the other employment-related statutes and say, this is a remedial statute. It's intended to benefit people who don't have health insurance coverage. So if there's a question as to whether or not they're an employee, we're going to interpret it on the side of finding that they're an employee. So as you're considering who's your employee and who's not, you probably ought to assume that if a court is looking at it down the road, they're going to be apt to find that this person is an employee, because that works to the benefit of what the purpose of the statute is.
You want to touch on the penalties, or you want me to?
Go ahead.
Okay. So it seems like the first 3 or 4 years of the bill, of the statute, are designed at getting employers, giving them some incentives and some reasons to provide health insurance, and then that's kind of the carrot. And then 2014 seems to be the stick, where it's, if you haven't, then we're going to penalize you. And even the taxes don't really kick in until 2013, so we don't start paying for this for a few years. But there are several penalties in here. They're in your materials. Probably the one we'll spend the most time on is the second one, where the employers could be subject to a $2,000 per employee penalty if they are required to provide health care and do not. And we're going to spend a little more time on that later on. That's probably the one that affects most people in the room the most in terms of the penalties. There are 3 others here that we've outlined on the slide that will also affect employers, and in some cases, individuals. So I guess I do want to go ahead and touch on that third one. Failure to meet individual responsibility to participate in a plan could lead to a penalty of about $700. I saw an article just last week. I believe it was it came from the Associated Press. I think it was on MSNBC, but it said that the Office of Budget and Management estimates that 4 million Americans will not have health insurance and will pay this penalty. And the government is anticipating that that's going to generate almost $3 billion a year in penalties starting in 2016, when the penalties are fully phased in. And that to me seems a little scary, because the people that should have health care, or that the government says should have health care and don't have it, probably don't have it because they can't afford it. And that's effectively what a lot of the literature is saying, is that's effectively a tax on that group of people whose income is less than $250,000 a year. So even though we've had, not to make it a political thing, but even though we've had, campaign promises we're not going to do this, the reality is the mechanism that happens will wind up and catch probably 4 million people, it's estimated. So.
Okay, I think right now we're going to talk about what parts of the Act are in effect now. And as Clinton said, and Karen mentioned, this is a statute that starts now and has provisions that go into effect as late as 2018 and 2020. So it's a very long timeline before it's all fully in effect. But there are provisions that are in effect right now. And one of them is that employers are required to provide reasonable break time to any nursing mother employee who wishes to take a break from her work to go express breast milk for her baby. This applies until 1 year following the birth of the child. The employer is also responsible for providing a space for the mother to use for this purpose. It can't be a bathroom, and it has to be a location that is shielded from view and not subject to intrusion. So look around your place of business, find some little room that doesn't have any windows, then you can put a lock on the door, because this is what you're going to have to do for the nursing mothers. It's interesting that the statute is broken down as Bill said, it's thousands of pages long, and there is one section that's called employer responsibilities. So when I was initially looking for this section, because I'd seen some articles, I thought, oh, this will be in the employer's responsibilities section. It's not. It's in the section called preventing chronic disease or something like that. So you'll have to have a little broader scope to find this. This is an amendment to the Fair Labor Standards Act. This addresses employee break times. And it says the mothers get this break time. It has to be reasonable. The statute doesn't define what's reasonable either in terms of frequency of breaks or length of breaks, but employers are required to provide that reasonable break. The break time does not have to be compensated, and if you're an employer who has fewer than 50 employees, the statute applies to you, but you might be able to get an exemption if you can show that it creates an undue hardship. You know, if your manufacturing line shuts down when mom goes off to take her break, or your facility is such that there isn't any possibility of having a space devoted to the purpose intended, you might be able to show undue hardship. We won't know exactly what that's going to take until we get some regulations from the Department of Labor. A second provision that's currently in effect says that chain restaurants that have 20 or more locations must post nutrition information for the food items that they serve. And the statute says that it's required to be posted on the menu, and that in addition, the restaurants must post information including a succinct statement concerning suggested daily caloric intake.